We want to get back to our top story. The superbug in California, what's known as CRE, has already infected 7 patients, including 2 who died in Los Angeles. Hospital officials say a whopping 160 others may have been exposed through contaminated medical instruments. Joining us in the studio, internist and travel medical doctor Ronald Primas. Thanks so much for being
here.
Thanks
for having me, Wendy.
So how much do we know about the superbug?
It's been around for a while. We've known about it since like 2001. And there's a lot of superbugs. It's not this particular one. This particular one is causing a newer outbreak, but it's been around for quite some time.
So these patients may have been infected by medical scopes that were supposed to be sterilized. So if they were sterilized, why did they infect people?
The particular scope that they used for this procedure has a different angle at the tip. And what happens is it's not like a regular colonoscope. It's a duodenoscope where it goes in the upper part of the stomach and into the intestine, and it has to have a certain kind of hook to it so that it can get to the area that it needs to get to. It makes it a little more difficult to clean and sterilize. They do the best that they can. Well, I mean, they're supposed to do everything they can to do, and they follow the manufacturer's guidelines and instructions. But in these particular 2 scopes that they used, there seems to have been some kind of defect.
If there's no antibiotic to treat it, then how can you prevent its spread?
Prevent it by using good hygiene, right? You want to make sure that, well, these particular scopes that they use now, they put out of commission. What they're going to try to do next is every time they use this type of scope, they're going to hang it to dry for longer than they need to let the lumen dry out, and most bacteria die when they're exposed to air. And there are antibiotics that they can use to treat. There's very few, but there are some antibiotics still left to treat this. But understand that the people that did get infected are usually really, really sick. That's why they got these procedures in the first place. Most people with a normal immune system wouldn't succumb to this kind of infection.
So even though it sounds scary, the general public not really in danger?
Not really in danger at all. I mean, moving down the road, like for example, there is an organism called Clostridium difficile, and that originally was in a hospital setting and now has made its way into the community. But even in those cases, it's very limited in its spread.
Okay, you bring us good news. We like it. Dr. Primas.
Thanks for having me, Wendy.
Thanks so much for being with us.